This is the 12th video presentation for the Case Animal Science course. Respiratory and Circulatory Anatomy, Lesson 4.3, Breathing, Beating, and Body Controls. By now, you should have completed Part 1 of Activity 4.3.1, Show What I Know. You attempted to identify and explain the function of the parts of the respiratory and circulatory system. This video is intended to help you acquire additional or correct information about the respiratory and circulatory systems, which are closely related. Other body systems that are tied to these systems are the nervous, renal, and endocrine systems. As you view this video, make notes of important information on your student worksheet. The respiratory tract is divided into the upper and lower portions. The upper portion consists of the nose, nasal cavity, pharynx, and larynx. The trachea can be considered an upper or lower part. Air enters and exits the body through the nose and or mouth. The nasal cavity warms and moistens the air before it passes into the lungs. The nasal cavity also filters particulates from the air and contains the olfactory or smell receptors. The pharynx is the joint passage of the respiratory and digestive tracts, commonly referred to as the throat. It is also where the nasal and mouth passages join. In the pharynx, epiglottis is a small flap that closes the passageway to the lungs, forcing food down the esophagus to the stomach. The epiglottis opens to allow air into the lungs. The larynx connects the pharynx to the trachea. It is also the site of the vocal cords, which produce sound. The trachea connects the larynx to the lungs. It is commonly referred to as the windpipe and is composed of dense cartilage rings. These rings often keep the trachea from collapsing and closing off airflow. The lower respiratory tract consists of the bronchi, bronchioli, alveoli, and lungs. The lungs are the main organ of respiration. The base of the trachea branches into two main bronchi, leading to the separate lungs where the airways further divide into smaller bronchioles. At the ends of the bronchioles are the alveoli, which are small air sacs that contract and expand with each breath. The alveoli are connected to the capillaries and allow diffusion of oxygen and carbon dioxide. Alveoli look like small grape clusters. There are two components of the circulatory system: systematic and pulmonary circulation. The heart connects these two systems. The four main chambers of the heart channel the flow of blood to and from the body, passing through the lungs to enrich the blood with oxygen and expel gases such as carbon dioxide. Capillaries are the smallest blood vessels within the body. They are the site of nutrient and gas exchange between cells and blood. Conversely, the vena cava and aorta are the largest blood vessels in the body. The vena cava brings blood to the heart from the organs, and the aorta returns blood to the body. The final two components of the circulatory system are the arteries and veins. Arteries carry blood away from the heart, while the veins bring blood back to the heart. An easy way to remember the direction of flow is the letter A in arteries also stands for away. Typically, arteries carry oxygen-rich blood to the organs and veins carry oxygen-poor blood to the heart. The exception is the blood flow between the heart and the lungs. Oxygen-depleted blood flows through the pulmonary arteries to the lungs and returns enriched with oxygen through the pulmonary veins. List any questions you have about this topic. Discuss these questions with your instructor. Use the information you have gained from this presentation to check your work on Activity 4.3.1, Show what I know, and correct any mistakes. At this time, you will complete Activity 4.3.1, Show What I Know. Then prepare for Activity 4.3.2, Take a Deep Breath. During this activity, you will describe the process of gas exchange in external respiration and determine the presence of carbon dioxide in exhaled air. This will help you understand how external respiration is a process of gas exchanges between the lungs and blood. Your instructor will share specific instructions for Activity 4.3.2, Take a Deep Breath.